The National Council for Behavioral Health has produced this series of short educational videos for the New York State DSRIP program to assist PPS network providers with implementing best practices for integrated care. The following instructional video demonstrates actions you can take to conduct a brief intervention within an integrated care setting.
SBIRT, or Screening Brief Intervention and Referral to Treatment, is an evidence-based early intervention protocol designed to help people reduce their problematic substance use. This is an example of a brief intervention being used in a primary care setting. Hey Stephanie, how have you been?
I've been good. How about you?
Been doing well. How's school going?
It's good. It's about to finish up, so I'm just finishing all my final papers. You know, work's work. But I'm still finding time to go out with my friends.
So I wanted to follow up with you. At this practice, we ask all our patients a set of questions about drug and alcohol use. It's a part of a larger lifestyle assessment, and they are confidential. And I was wondering if I could speak with you about them?
Yeah, sure.
From your screening, your scores indicate that you're in an at-risk category for drinking, meaning that you're above the recommended limits. And I wanted to follow up with you just to learn more about that.
I'm a social drinker. I have 3 or 4 glasses. I don't drink excessively or have an alcohol problem or anything like that. So I don't understand really.
Okay, well, we certainly want to talk more about that. And I'm wondering if you could tell me just a little bit about the good things that come along with drinking.
I mean, balancing school and work is a lot, and I feel like I'm working, doing something 24/7, so this is just my time to unwind with 3 glasses of wine or something. I don't know, it makes me feel better and feel more relaxed.
So most of the health problems associated with drinking are actually among those who we wouldn't label as having a severe alcohol issue. And specifically with your stomach, drinking could lead to gastrointestinal issues, ulcers, inflammation, and other types of health problems.
I mean, it's eye-opening. I guess I'm just processing the information. I had no idea.
Okay, so it sounds like on one hand, it can help you relax and unwind. At the same time, it could maybe cause some of the health issues that you're having and help you feel like you're not at 100%.
Right, yeah.
Okay. So I'm wondering if you'd be interested in making any changes to your drinking.
Yeah, I guess so. Okay. I mean, nothing, I'm not going to stop drinking, but I can make little changes.
Okay, so what would a little change look like for you?
Maybe cutting back the number of drinks.
Okay, so cutting back a drink or 2, I think, can make a big difference for your health. It's a good step in the right direction. I want to show you this Readiness Roller, and we use this to help assess how prepared people are to change. And I'm wondering, on a scale from 0 to 10, how confident are you that you can make this change?
I think a 4.
A 4?
Yeah.
Okay. And how come you didn't choose 2?
I feel like I'm wanting to make the effort to change.
Okay.
So it's not just me talking about it, I want to do something about it, so.
So it sounds like when you decide to do something, you really invest in it.
Yeah.
Okay, that's great. That's a great quality to have.
Thanks.
So I also want to let you know that we're here to help support any positive change in your health, whether it's related to alcohol or any other health issue. And so I just wanted to let you know that we have your back with this.
Thank you.
And I was wondering if you'd be interested in really writing down a plan for what this would look like in the real world.
Sure, as long as I get some help from you.
Stephanie, I want to thank you for being so open with me today, and we look forward to more progress in this area.
Thank you for watching this DSRIP educational video on a brief intervention for alcohol use. The flow of a brief intervention will change depending on the situation and patient. We presented one example of what a brief intervention could look like. To recap, the primary care provider should incorporate the following stages during the brief intervention. Build rapport. Forge a non-judgmental connection with your patient. Raise the subject. Explain your role, introduce the process, and ask for permission to have a discussion about alcohol use. Provide feedback. Share pertinent information and elicit feedback from your patient. Enhance motivation. Use reflections and other tools to increase your patient's readiness to address and change their health behaviors. Negotiate a plan. Negotiate a goal with your patient based on the steps she or he is ready to take. Thank you again for watching. Please refer to the following websites for additional information and resources.